As you anticipate recovering from your lumbar fusion, one of the services that we have offered to our patients are home health services. So let me explain a little bit why we do this. We work with different home health agencies in our area, and what they do is they come into your home after you've been discharged from the hospital. And the goal is to help you transition from being in the hospital to being independent at home. There's a lot of questions that come up, questions that you may have thought to ask and forgotten to ask, or maybe you asked them and the doctor said something to you and you haven't remembered, or maybe something came up that you didn't think of. The home health service can help you as an educational resource. That's number one. Number two is they can be another set of eyes and ears for safety. Maybe there's safety issues in the postoperative period that they can be aware of. For example, they may notice that your leg is swollen, and that could be a sign of a deep venous thrombosis that needs attention. Or they could look at your lumbar wound, which you may not be able to see very well, and they could check on and make sure that it looks okay. Encouragement and counseling is another purpose of the home health service. Maybe you're feeling a lot of pain, or you're wondering why you're in so much pain on postoperative day number 6, and you weren't in that much pain when you first went home from the hospital. This is actually normal, and there's some things that can be done to help you through that a little bit more painful period after the recovery. You do not have to do home health. You may be worried about the cost, or that it's too much burden to have somebody coming into your home, and if that's an issue for you, then you can elect to not do home health. But I would encourage you to consider at least having them come in and counsel with you and work with you until you're at a point where you feel confident and independent at being on your own at home and able to do your activities of daily living and have a good understanding of where you're at in that postoperative phase.